Welcome to Medlive. Today's program is Taking Charge to Easier, Strategies to Address Nasal Polyps. My name is Dr. John Basso. I am an allergist and immunologist, as well as a clinical professor in the Division of Rhinology in the Department of Rhinolaryngology, Head and Neck Surgery at the University of Pennsylvania, Perelman School of Medicine. I am joined by Sanaz Eftekhari, Vice President, Corporate Affairs and Research at the Asthma and Allergy Foundation of America, who will speak about her experience dealing with NASALS. We'd like to hear from you during this program, so please take a moment to ask your questions. Just type them into the box below at any time during the discussion. Please keep in mind that the questions should be general in nature. We are unable to answer specific questions about your case, but we encourage you to bring those questions to your doctor. For your reference, the presentation slides are available for download in the event resources section of the player located under the video box. Here are our disclosures. Here are the learning objectives. 1, to communicate with healthcare professionals about symptoms that may indicate nasal polyps in order to reduce time to diagnosis. 2, to identify current and emerging strategies for managing nasal polyps. 3, to practice what's called shared decision-making with clinicians regarding care for nasal polyps to shorten the diagnosis time and to optimize therapy. In today's program, we will talk about the symptoms of nasal polyps, if surgery is the only option, managing nasal polyps with medication, and making your voice heard. That is, talking to your doctor in order to reduce the time to diagnosis and improving your access to treatment. Let's get started with what are the symptoms of nasal polyps. First, what are nasal polyps? Well, nasal polyps are very soft, non-cancerous, usually painless growths that start at the lining of your nasal passages and your sinuses. They're shaped often like grapes or teardrops, and they're usually present on both sides of the nasal cavity, and they are a result of chronic, long-term, persistent inflammation and swelling. Who gets nasal polyps? A lot of people. It's very common. Up to 13 million people in the United States have nasal polyps, with the average age of onset about age 42. So we often say this is a diagnosis of middle age because patients are often diagnosed somewhere between the age of 40 and 60. Now, although nasal polyps are more common in men, women usually have the more severe cases. That brings us to our first polling question. What are some of the main symptoms of nasal polyps? Is it A, severe headaches, nausea, and vomiting? B, blurred vision and trouble hearing? C, stuffy or runny nose, loss of smell or taste, sinus pressure? Or D, dizziness and loss of balance? Go ahead and vote for A, B, C, or D. And while the audience answers, I'm going to ask Dana, what are your symptoms? And which ones bother you?
Definitely congestion. Definitely, I felt an ear aches and just pain. I didn't get dizziness, but I felt I couldn't smell very well. I was just like, I could not breathe through my nose. Just a kind of a little bit of trouble breathing. Just kind of like I had allergies, tremendously bad allergies.
So it looks like the majority of our audience is answering C. And that certainly seems to be consistent with the most common symptoms that patients get with nasal polyps. Thank you, Dana. So the symptoms of nasal polyps typically are runny or stuffy nose, postnasal droop, loss of smell or taste, headaches, sinus pressure, and the allergy-like symptoms of itchy eyes and sneezing. Which brings us to the next audience polling question. Of which of those symptoms seem to bother you the most? We know a cluster of symptoms, but which one bothers you the most? A, loss of smell or taste, B, headaches and sinus pressure, C, itchy eyes, or D, sneezing. Dana, what symptoms bother you the most?
Well, personally, what bothered me the most was the congestion and just my ears not being able to hear, just it was like my whole face was just impacted and just I could not breathe very well. It was horrible.
So it looks like the majority of patients are answering headaches and sinus pressure, which seems to be the most bothersome symptom for patients and often the symptom that brings them to their provider. To over to Sanaz.
Thank you, Dr. Basso, and thank you, Dana. So if you guys find nasal polyps hard to deal with, you're definitely not alone. Here's a great quote from Dr. Palmer at University of Pennsylvania, who said, "This is a serious disease that causes significant suffering due to inflammation. In fact, the decreased quality of life matches that of other serious conditions such as congestive heart failure, chronic obstructive pulmonary disease, or coronary artery disease." We're going to go to our next polling question. So which of these characterizes your personal journey to diagnosis? Is it A, you saw your primary care provider who immediately diagnosed you? B, you saw a specialist who immediately diagnosed you? C, you saw several doctors, including primary care and specialists before being diagnosed? Or D, it took several years because you were not ready to talk about your symptoms? And Dana, how about you? What was your journey like in terms of getting to your diagnosis?
Well, I had grown up experiencing having asthma at a young age, and I've had allergies all my life. I just usually medicated with antihistamines and just over-the-counter allergy medicine. And then when I was in my early 40s, I started experiencing really painful ear infections. And I had never experienced ear infections my entire life. So this was something new. And I first just went to my primary care physician, and she referred me to an ENT specialist after there was seemingly nothing that she could diagnose at the time. Once I saw my ENT specialist, I had gotten referred to an audiologist because that was my main symptom. I couldn't hear very well. And then after that came back normal, we did a CT scan of my sinuses and came back that I had bilateral polyps in both of my nostrils, and they were seemingly huge to my physician, and she was surprised I could even breathe through my nose. But I was able to. And after that, after the diagnosis, she put me on prednisone to take the swelling down. And then after that, just some flushes with some medication. And that's kind of how I've managed since then.
Thanks so much. And it looks like the majority of our audience answered C. So similar to your story, Dana, they saw several doctors, including primary care and specialists, before being diagnosed. So a little bit about coping with nasal polyps. As you can imagine, there's major negative impacts on quality of life and sometimes psychological health. A lot of patients talk about the ups and downs with many bumps in the road. A lot of people talk about the difficulty sometimes of getting diagnosed. It can often be a long journey, an average or up to about 10 years. Relief and hope can come with diagnosis, but it turns out, sometimes people are disappointed if they're going through all these different treatments and seeing different doctors, and if the treatment is not effective or if symptoms return.
So how are nasal polyps diagnosed? As Dana alluded to, they present with different symptoms, and they can be sometimes difficult for doctors to figure out exactly what's going on up front. So your doctor may make the diagnosis based on your answers to some questions, a general physical, especially an examination of your nose, and he may use a nasal endoscope to get a better look at your nasal cavity. Images such as CT MRIs may be performed. Usually CT scans are much more effective when looking at the sinuses. Allergy tests may be performed, as well as some blood tests, including vitamin D. Low levels of vitamin D have been to be associated with increased incidence of nasal polyps. So who treats them? Well, as was already mentioned, a variety of physicians include primary care physicians, ENTs, which can be sinus surgeons in most cases, and allergy specialists or allergist immunologists are all involved in treatment of nasal polyps. Okay, so now what we'd like to talk about is we'd like to show you a clip of Lakia and Peter discussing their story in terms of the impact of nasal polyps on their quality of life.
Although my doctor diagnosed me with asthma, he also checked me for polyps as well as an adult. I would have to say my entire life has been a struggle with the asthma and allergies, but the polyps, it definitely adds to it. It's definitely challenging, like the asthma and allergies. So I still have my restrictions, The restrictions I have is like, even with allergies, you have to be careful in certain environments, also being around certain things that can trigger your allergies. So same with the polyps, same thing. You have to be always cautious, in the back of your head, what to be around and what not to be around.
I grew up in the country, and I never had a problem with allergies, but I got allergies one fall back in 2000 actually. And they were so bad that I went to the doctor. I couldn't even breathe through my nose. So the doctor put me immediately on an antibiotic, an oral steroid, an inhaler, probably 6 or 7 medicines. I mean, there's more medicines than I've ever been on my whole life. And I literally could not breathe through my nose. So he referred me then to an ENT. But, I had a lot of coughing, a lot of congestion. And, when I went to the ENT and he diagnosed me with nasal polyps, and, nothing was really traveling through. So I was getting sick. I was getting a lot of chest infections and a lot of things like that. He then recommended surgery for me, but I was resistant to getting surgery because I had heard terrible things about surgery. And so I asked him if he could give me injectable steroids. And so he did give me an injectable steroid. And, I went on for 4 years, him trying to get me to get surgery, and then I'm not getting surgery. And I'd be miserable for, most of the time, but I'd get this injectable steroid and I'd be okay for maybe 3 weeks. And then I'd wait another 2 months, 2.5 months to get the shot again. And finally, after 4 years of this, 4.5 years of this, I agreed to get the surgery in 2005, and I had them removed. I couldn't smell flowers. I couldn't smell perfume. I couldn't smell anything really. And, now it's totally different. I couldn't smell the coffee I drank in the morning. It was really very severe. So it really changed my life. And of course, constantly being sick, constantly having to take antibiotics and steroids and things like that, because you're just you're becoming a factory for infection when you have these nasal polyps, because you're just not breathing. You're not getting the circulation of clean air. And
so Dana, how did your experience compare?
Just all of the medications, just the different allergy medications and my inhaler for asthma symptoms. I just wasn't sure, what to do. I totally can relate to this patient as far as not knowing how to, I wouldn't self-diagnose, obviously, but just, what to tell my doctor exactly. But in my case, it was more of, head congestion and headaches and just feeling, stuffy, congested all the time.
Okay. So next we're going to take some questions. And the first question is, how do you recommend someone who has rhinosinusitis that's difficult to control tell their doctor about their nasal polyps? What I would like from a patient is hear specifically what their symptoms are, how long they've been going on for, also how they're impacting their quality of life. That's important to me because there's a big difference between when your quality of life starts becoming affected. And so, as Dr. Palmer said, the quality of life in patients who have severe nasal polyps is quite dismal. And I don't think doctors often appreciate the severity or the effect on quality of life. And this is important to get to the right specialists when patients are having this type of experience. The second question is, how are asthma and nasal polyps related? Well, it's a interesting relationship in that we all feel that there's a higher incidence, first of all, statistically, of polyps and asthmatics and asthma and nasal polyp patients. And that likely relates to the same inflammatory process that's on in their upper and lower airway. We think that in many of these patients, there's what's called a unified airway. And so this inflammatory process seems to affect both of them in a number of patients. And so what the relationship is, and so there definitely is a higher in a patient who has asthma to look for nasal polyps, and the reverse in a patient with nasal polyps to ask questions about their experiencing asthma symptoms. Now let's talk about surgery for nasal polyps. Is surgery the only option for nasal polyps? So what is surgery for nasal polyps? Well, first, the surgeon would insert a small tube, an endoscope, with a lighted magnifying lens, camera, nostrils, and then advance it into your sinuses. He then uses very tiny instruments to remove the polyps. And while doing this surgery, the surgeon also tends to enlarge the nasal openings from your sinus, improve overall drainage, as well as aeration and ability for topical therapy to reach the sinuses. So our next audience polling question, following up on surgery, is if surgery was an option for you, when did your doctor talk to you about it? Would you say A, right in the beginning when I was first diagnosed? B, after my first medication didn't work? C, after I took a few medications? D, after nothing else worked? Or E, my doctor has not mentioned surgery as an option? So while we're waiting for the audience to respond, Dana, tell me, when did your doctor first talk to you about surgery?
After I had been referred to my ENT physician, she actually had brought up right away that surgery may be an option for me if the medication didn't work for me, kind of a last resort in that case. And it sounded all right. I mean, it's an outpatient procedure, so it didn't sound too horrible, but I was happy that the medication worked in my instance.
That's great. And it looks like, actually, surprisingly, the majority answer is A, right in the beginning. So, so surgery was suggested quite early it looks like, for the majority of our viewers. Okay. So where is the surgery done and what comes next? Well, it's almost always done on an outpatient basis. And after the surgery, you're often told to use a saline or saltwater rinse to help with the healing of the sinuses. And you may use a corticosteroid nasal spray, corticosteroid rinse to help prevent the polyps from coming back. Once again, let's poll the audience about, does surgery for nasal polyps work in all or most cases? Answer one, yes, it takes the polyps out. B, no, it hardly ever works. C, it works, but it can be dangerous. And D, it usually works, but the polyps can grow back in many cases. Let's see what the audience says about those choices. And it's interesting the perspective that people have about this. Patients don't really know. They think of polyp surgery as being similar to surgery for your knee or surgery for your hip, and it's a one and done. And once it's cured, it's sort of cured by surgery. And the majority have answered D, and this is really the correct answer. And so, although surgery usually does work, and of course, it has to be done completely in order for it to be a success, but the polyps can grow back in many cases, especially when surgery is performed without any follow-up medical therapy. So how well does surgery work? Well, if surgery alone is used, you can expect that nasal polyps will come back in up to 40% of patients, 4 out of 10 patients. But some of the newer medical approaches, tag teamed after the surgery, put into effect after you have surgery, should improve the success rate in patients who have surgery. So how can I decide if surgery is right for me? Well, again, this is something where you need to work with your doctor as a full partner. Make sure that your treatment decisions are shared. And some of the questions you may want to ask are, well, why do you think surgery is a good option in my case? Are there any other options we should consider first? How likely is surgery going to be successful the first time? And if it doesn't work, what other options do we have? And what should I expect during and after the surgery? Expectations are very important. As I said, patients sometimes expect that surgery is going to be a cure for nasal polyps, and it often is not by itself. It's very different from a lot of other surgeries where that is sort of the standalone procedure. And also you want to know, what am I going to do after surgery, especially to prevent regrowth of new polyps? Now let's watch a clip of Peter. He's going to discuss various therapeutic options that were presented to him.
I decided to have the surgery after about 4 years of getting quarterly injections, and my doctor essentially telling me that it really wasn't responsible to just get injections to solve a problem. And it really wasn't solving the problem. It was just, getting rid of the problem for a few weeks and then it would come back. So I decided to get surgery. I was very nervous about surgery because I had heard about, I had a friend who'd gotten it 30 years before I got it. It was terrible. But now I find that the surgery was actually not as bad as I had thought. I wouldn't want to get 2 surgeries because of, I think a second surgery is less desirable. But I did decide to get it after talking with my doctor and understanding it would be, outpatient, and they don't, the kind of techniques they use were very advanced. And so I was very, very reassured by that. With regard to treatment, the next steps for me are that I'm just going to continue to take my nasal spray, which I take specifically for those polyps. I also just take some stuff for asthma.
So Dana, we know you didn't have surgery, but how did your experience compare to this?
Well, I was presented with several different options, which I was happy about. I I appreciate that years ago that the surgery wasn't very good for a friend of Peter's, and that's unfortunate, but I think that things have come a long way since then. So if it were an option for someone today, I think that, I mean, definitely to be able to feel better and to be able to smell and not have all the symptoms, it sounds like a great way to go.
Sure, no, there's no question. I remember the early days of sinus surgery, and it was sort of barbaric. Before endoscopic sinus surgery was introduced to the United States by Dr. David Kennedy, who's our senior member of our department. Before surgery was done through endoscopes, it was something that was almost never thought about as an option. And so that revolutionized the way we looked at surgery. And so that's very different from what used to happen, what may have happened to his friend 20 or 30 years ago. So now we'll go to questions. And the first question is, when does the doctor decide that surgery is needed? Well, that's going to vary, I think, based on the physician's background. Surgeons are going to be more likely to think of surgery as perhaps early on because related to their training, whereas allergists may not be thinking of surgery as the first option. But I think that most of us believe that basic medical therapies need to be tried before discussing surgery. But sometimes it will depend on the severity of the patient's case, of how much has been done before the patient even gets to you. And I often want to know, what have they tried? How long have they been dealing with this? How long have they had the problem? How is it affecting? And are they also a good candidate for surgery? I mean, there are some patients that just have medical problems that make them very risky surgical candidates. Another question is, how long do polyps take to come back after surgery? Well, that varies. That varies dramatically. We see that there are different subtypes of polyps. And so certain subtypes will recur very quickly. And other subtypes will take years to recur. So that's hard to answer definitively until you know exactly the subtype that you're dealing with. And the other part of the question is, if they disappear for several years and come back, what are the risks for recurrence? And I kind of say, well, the longer you've gone without recurrence after a surgery, the more likely that if you need a second surgery, it's going to last about the same amount of time. Again, it's hard to predict because you have to factor in what medical therapies that patient received after their surgery, how compliant were they with those medical therapies. And so it's important that we give patients regimens that we know they're going to continue to use, and that we're not unrealistic about our expectations of what a patient will do years and years and years down the line. And then another question is, are there cases when surgery is not an option? Yes, I mean, there are situations where patients are just bad medical cases where they have so many medical problems that surgery is not an option. So I think that you have to take this on a case-by-case basis and factor in numerous situations related to severity, quality of life, with the patients. What are the patient's preferences? Obviously, always come into effect. What has been used before and tried before is also very important. So now we're going to talk about how to manage nasal polyps with patient.
Thank you, Dr. Basso. So here are a few direct quotes from patients who have experience with the medication treatment journey. So I tried antihistamines, at least 10 different nose sprays, decongestions, antibiotics, montelukast, vitamin supplements, special diets, and none of these things helped at all. Another patient said, you just hope that it's something that's going to be gone forever. You don't expect it to come back. And really, you wasted time and money. You've wasted everything to be back in the same position you were when it all started. So we're going to do another polling question. Can you relate to any of the statements made on the previous slide? So option A is no, not at all. The medication journey was really a breeze for me. We found the right medication the first time out. Option B is I can relate a little bit. I really thought it would be easier than it was, but I got through the process of searching for the right medication. Option 3 is I can relate. I feel the same way. And option D is I definitely can relate. I still haven't found the right medication and I've been trying for ages. So Dana, can you tell us a little bit about your journey with medication?
Yes, yeah, I had seen, doctors for my allergies for years, and I always thought it was asthma related. And I had tried pretty much every over-the-counter nasal spray, every antihistamine, every allergy pill, just to see, switch up things to see what would work for me. I also used my inhaler for asthma symptoms. And yeah, it just seemed like nothing was working. It was hard. It was a challenge.
Yeah, I can definitely relate to that. And it sounds like a lot of people can relate to that. A majority of the audience answered D, that they definitely can relate. So Dr. Boss, I'm going to pass it back over to you.
Thank you. So what issues underlie nasal polyps? So we don't fully understand the causes and contributors. Certainly a lot of studies being done to try to get a better handle on different subtypes of nasal polyps and what may be triggers to start the process of nasal polyps. But there are certain conditions that have been found to contribute. And these include a type of allergic cell known as eosinophils. So the majority of patients, probably around 85% of patients in the world, have high eosinophils. These are these inflammatory cells within their polyps. Another factor that seems to be important, impairment of the sinonasal epithelial barrier. That's the lining of the sinuses. And once that happens, it increases exposure to various allergens and viruses and particles in the environment that seem to stimulate further inflammation. So there's a breakdown of that barrier. There's an immune response from breaking down that barrier, and there's further breakdown once the barrier is broken by environmental factors. And the other thing is that there may be infection or colonization by certain bacteria, such as Staph aureus and Pseudomonas, that have been known to be promulgators of polyps, keep polyps going. So our next audience polling question is, which of the following is true of medication for nasal polyps? A, surgery is preferable to any medication. B, several types of medications are available and they all work in different ways. C, all the medications are basically the same and work the same way. Or D, if you take medication, you need to use several different kinds at the same time. Have the audience poll on that. And interesting to see how they answer this question. Okay, so they're thinking, I think, in the correct way, in that several different kinds of medications are available. They all work in different ways. So each of these medications that we have that are available, we're going to speak about, they all have different mechanisms of action, which is probably good because it sort of attacks different areas. Again, none of them are a cure, but attacking different parts of the polyp inflammatory cascade is very important for effectiveness. So let's take a brief glance at the type of medications that are available. Nasal corticosteroids, we mentioned those. Oral and injectable corticosteroids were also mentioned. How about the newer biologic medications? We'll talk a little bit more about those, and also other medications. So So one of the first medications given to treat nasal polyps should be nasal corticosteroids. They're used to reduce swelling and irritation and then shrink down the polyps. That's the goal. However, most of these nasal sprays really don't reach far enough and deep enough into the nasal cavity to have a therapeutic effect. And these are often your over-the-counter fluticasone, budesonide, mometasone, etc. Side effects may include a stinging or burning sensation in the nose, dryness or crusting, dryness or irritation of the throat, an unpleasant taste, or nosebleeds. Now, oral corticosteroids such as prednisone may be your doctor's next suggestion if a nasal corticosteroid is not as effective. So these may be prescribed alone or in combination with a nasal corticosteroid. And injectable corticosteroids may be prescribed for severe nasal polyps. The side effects are numerous. Only a few are noted here. And they may include swelling of the legs due to fluid retention, hypertension, mood swings, change in behavior, upset stomach, weight gain, and with persistent use, things like glaucoma, cataracts, high blood sugars, and thinning of the bones, and even fractures of bone, particularly in the hip area. So the bottom line for corticosteroids, they can help. The oral and injectables certainly can help, but they have serious side effects, especially long-term, and should only be used for short periods of time. Let's discuss a new device called the exhalation delivery system with fluticasone. And this device sprays the fluticasone, which is a topical steroid, into the nasal cavity far and deep where polyps start. And it actually has a mouthpiece that you blow into. So you don't sniff, you actually have a mouthpiece and a nasal stented piece. And your breathing actually helps deliver the medication high and deep into the nasal passages where the nasal polyps start. So it's a very innovative delivery system of a medication to try to overcome some of the deficiencies of the standard sprays. Effects include the same type of side effects, including nasal bleeding and sores, pain in the throat, nasal and sinus infections. Other side effects are less frequent, but again, this is something that you can discuss with your doctor. What's science behind this delivery system? Well, there have been 2 randomized double-blind placebo trials with over 600 patients who had moderate congestion, and they received either this device or this device either with placebo or this device with active medication, active steroid. And all the patients that had the medication and the new device showed a significant improvement in both nasal congestion, polyp grade, as well as other symptoms of congestion, pressure, runny nose, postnasal drip, and sense of smell. The side effects were generally those of nasal corticosteroids. Let's turn to biologics and briefly talk about them. So these are among the most recently approved medications for nasal polyps. Why do we call them biologics? Because they're made in living organisms. There have been 2 antibodies that have recently been approved by the FDA for nasal polyps, called omalizumab, and the other is dupilumab. Omalizumab, or anti-IgE, blocks the IgE responsible for inflammation, and dupilumab blocks the action of 2 key agents that drive inflammation. And dupilumab actually acts higher up in the cascade of inflammation than omalizumab. Now, biologics have been shown to work in people who also have asthma and chronic sinusitis. Approved for asthma for several years. So these are given by subcutaneous injection, needle under the skin, usually every 2 weeks, and they can be given by your, or they can be given by yourself. Once you're trained to give it, you can self the injection at home. Biologics often work when other medications do not. They target inflammation, and they do so in a very potent way with less effects than oral corticosteroids. What are the side effects of dupilumab? Well, dupilumab side effects typically include redness or pain at the injection, which is similar to that of omab. Biological side effects can cause some eye problems, mouth or lip sores, pains. You can see joints, especially also in omalizumab. More serious effects of dupilumab include allergic reactions such as hives, swelling, difficulty breathing, very rarely. For omalizumab, besides local reactions and joint pains, you can also get tiredness, swelling inside the nose or throat, and rarely reported, but a definite side effect to be aware of is that there can be threatening anaphylaxis, which is a whole body allergic reaction. So discuss these with your doctor, which should be reported right away. So what did the study show on biologics? Well, the omalizumab study showed that patients who failed treatment with steroid had reduced polyp sizes, they had reduced nasal congestion, their quality of life improved. Omalizumab can take several months to work. So if a patient gets prescribed this, there needs to be some patience, and the expectations are that it will not work immediately. Dupilumab in patients who failed treatment with steroids or were not able to receive steroids or surgery reduced polyp size as well. It reduced opacification, which is the blockage of any clear signal through a CAT scan, and sinusitis symptoms. It improved the sense of smell, which is very key here. It reduced the need for surgery and steroid. It improved quality of life. And again, it can take several weeks to start working. So here's a suggested order for treatment. Who gets what treatments and when? Most patients are started on an intranasal corticosteroid, many before they ever see a specialist. And for those who aren't doing so well on intranasal corticosteroids, they often receive bursts of oral corticosteroids. Next are often to exhalation delivery system, which is the delivery system that gets the spray of steroid higher and deeper into the nasal cavity. If patients need further treatment, then at that point, they should be discussing this with their doctor. And they should also be discussing the idea of whether or not they have other conditions, such as asthma, because that can influence which treatments are used first, as I'll show you on the next slide. So when the simple things don't work, the next order of therapy for most patients will follow what's on the left side of the screen, most but not all. And most of those patients will end up having sinus surgery, followed by steroid irrigations and intranasal corticosteroids. And if symptoms don't resolve with that paradigm of surgery followed by steroid irrigations or intranasal corticosteroids, then you may want to get other specialists involved, because this is going to often be a multidisciplinary type of more refractory type of nasal polyp. And here's where patients may need biologics. They may need a repeat sinus surgery, and it's important that the sinus surgery be done completely up front, but sometimes not all of the polyps can be removed in one surgery. Again, depending on where it's done and who does the surgery. And aspirin desensitization is used for one group of polyp patients called aspirin-exacerbated respiratory disease patients. And this is a way to reduce inflammation in that special population. For local steroid-induced, inflammation that's induced by polyps that may hang out in one specific area of the sinuses, you may use sinus implants, which release very gradually from the area of the implant. And again, patients may need short bursts of oral steroids to keep them well. Now, for a smaller number of patients who may have issues having surgery or may have asthma issues, if they have severe asthma, they may shift over to this paradigm a lot earlier. In other words, they may be a candidate for a biologic if their asthma is severe, because no one is going to even consider surgery in a patient who is uncontrolled. And again, they may get more benefit if they have severe asthma along nasal polyps, and many patients do. And there are definitely patients who have declined surgery, that they're just fearful, or they, despite all the literature and the information you give them, they've heard about someone who's had a bad experience with surgery, and they may decline surgery. So for a lot of these patients, you may filter them into this paradigm earlier, this treatment pathway, biologic a lot earlier. So again, there's no cookbook here. It will depend on severity. It will depend on if you're working together with multiple specialists. It will depend on whether you have asthma. It will depend on whether you've had a prior surgery. It will depend on whether you've had oral bursts of steroids before. But these are sort of outlines for what's available and what thinking about when a patient comes in to see us and what we're going to discuss at what time. Okay, and so now we're going to watch a clip of Lakia and Peter. They're going to discuss how they went through this journey, like what was most helpful for them during this journey in terms of managing nasal polyps with medication.
My doctor decided to treat me with polyps. He, first of all, presented the surgery that you could have, but I'm already going for another surgery, so I decided not to go for a second one. But, it's medicines out there that you can take, to kind of maintain it, just like with the asthma and allergies as well. Luckily, the first treatment that my doctor prescribed, it actually worked. And I was surprised because sometimes, not all the time, the first medicine works. You have to go through a couple to find the right one because everybody has different symptoms for the medicine, for the better, for the worse. So I was lucky enough to, be prescribed a certain medicine and it actually worked, which was good.
Okay, so now we're going to go to the question and answers. And so the first one is, where can I get information about treatment options? It's a very good question. Of course, your doctor is a source of this. There are many resources from the AAFA, and of course, there are information specifically about medications that are in patient format. And the second question is, how are new treatment options administered? So I think we alluded to this already, that the injected biologics are under the skin. They're given by subcutaneous shot, and they are either administered in the physician's office or at home. And that's going to be a judgment call based on the severity of your problem, whether you have severe asthma as well. But most of them could be administered at home. In some situations, they may admit in the doctor's office. Okay. So now we're going to talk about making your voice heard. So when should you talk to your doctor so that you can get more quickly diagnosed and treated more effectively?
So here are a few more direct quotes from patients with nasal polyps. One said, I went back to my ENT specialist and had another round of prednisone, and all was well for a time. After that, it was a vicious cycle of feeling better and waiting to come back. Another said, because I looked and sounded sick, nobody got near me. I was so upset and felt like an outcast. So the next polling question is, what would be most helpful to you during this journey? And it might be an all of the above answer, but just go ahead and pick the one that would be most helpful to you. Option A is, I want to be able to talk with others who have nasal polyps, so I won't feel like I'm the only one. Option B is, I want to be able to access trusted sources of information, so I'll be able to make good decisions. Option C is, I want my doctor to ask for my opinions about treatment and listen to what I have to say. And option D is I want my doctor to take my feelings about this seriously. So Dana, can you relate to any of the questions or any of the statements, I'm sorry, on the previous slide? And what's your thoughts on what would be the most helpful to you as you continue in your journey?
Definitely, I can relate. Before I was diagnosed with nasal polyps, I had never even heard of such a thing. So just knowing that there's so many other people out there and it's a lot more common than I had once believed, it's great to know that I'm not alone and that there are effective treatments leading up to surgery that can help.
Definitely, yep. It looks like the majority of our audience said B. They want to be able to access trusted sources of information to help them make good decisions. So the next question is, what's the term for when doctors and patients educate each other and work together to develop a treatment plan? What is that called? Is it A, collaboration, B, listening and responding, C, shared decision-making, or D, mutual expertise? Okay, and the correct answer to this is that it's called shared decision-making, and we're going to talk a little bit about what that means. So shared decision-making is a really important part of patient-centered healthcare, and what it is a process where clinicians and the care team can work together with patients to make decisions, select treatments that work for the patient, to evaluate the treatment options, and to make sure that the expected outcomes are aligned with the patient preference and values. So when it's time to start treatment, this is where it's really important to have shared decision-making between a patient and their care team. So you and your team will review the options, including the benefits and risks of each treatment option. And you as a patient or caregiver will have the opportunity to ask any and all questions that you have. And then together you make the decision about which treatment is best for you. We always tell people, remember, your doctor is the expert on nasal polyps, but you're really the expert on you. You really both have vital information to share. I know Dana said a little while back that she really appreciated, the options being laid out for her and her having to have a say in whether or not to get surgery and which care path to go down. So there's definitely a lot of benefits of you having an active role in your care. So shared decision-making. Remember, really only you know what your experience is like living with nasal polyps. It's really important to communicate that to your care team, to your doctor. You only know whether your current treatment is working. So if you want or need to try something else, make sure you're communicating that again with your doctor. Talk about your experiences, talk about the impact on your quality of life. I know Dr. Basso said earlier, he always wants to hear from patients about how their quality of life is being impacted. So this is really important. It's important to know what's available as a treatment and what the pros and cons are. And then you have a right to know as a patient, so you can take an active role in the decisions that you make. And this will help get you to the most safe and effective treatment for you. So we're going to watch a clip of Lakia and Peter discussing their shared decision-making experience.
My doctor and I, we have a very good relationship. I'm always looking into, I'm always researching different stuff. So if I see something that fits me or possibly could, I definitely will reach out, and my doctor would, contact me, and we'll just agree on it and just try it. And I mean, my doctor will call me right back. I don't have to wait a week or 2 weeks or the day of my appointment a month later. I mean, we have that closeness, and I'm definitely appreciative of that, because not everybody has that. It's usually you have to wait for your next appointment or next year for your next checkup, So I'm grateful that I have a physician that I have.
I think as a patient, it's extremely important to be involved in your treatment decisions, because it's your body and it's your life. And most doctors just want you to get better. That's what they want. So they're going to give you, most doctors are going to give you the best advice they can. And you know, I also talked to my my general practitioner, and he told me that these doctors, that the specific ENT I was working with was not somebody who, you know, went in and just operated for the sake of operating. So I had a high level of confidence that I was making the right decision.
Dana, can you expand a little bit on how to talk to your doctor about your treatment expectations, what worked for you and what you would recommend?
Definitely. It was nice to have the choice, the different options that they laid out for me. So I was able to, try the prednisone first, and then try the nasals. Well, initially I probably tried the nasal spray, and then I tried the prednisone, and then the medicated saline drainage that I experienced. That was all very helpful, and just doing sort of, things that they suggested to do, and then knowing that, if that didn't work, that there was the possibility of surgery, which at that point I was fine with, because, after all, I just wanted to feel better.
Thank you. So I'm going to kick it back over to Dr. Basso for some more Q&A.
Thank you, Sanaz. So the next question is, what symptoms do you think about presence of nasal polyps in your patient versus allergies or CRS? Well, that's a tough one, because the symptoms overlap quite a bit. I mean, you have, as you saw, a lot similar in patients who have allergies or chronic rhinosinusitis. One of the things that seems to be very much a red flag for me to think about nasal polyps while I'm interviewing a patient is the loss of sense of smell. Now, patients don't always get this with nasal polyps, but that's one symptom that tends to distinguish nasal polyps. It seems to be the one that's a little different from your standard chronic sinusitis type symptom. And again, the sinus pressure is another symptom that makes me think of nasal polyps. Next question. What can be done for polyps that keep coming back after surgery? Well, I think it's important that we try to find the type of polyp the patient has as best as possible, and we don't have all the tools for definitively knowing all the molecular mechanisms behind every polyp. But if we can kind of get that patient to know whether they're allergic fungal sinusitis with polyps or aspirin-exacerbated respiratory disease, I think the diagnosis is important in terms of trying to get them into a certain category. I also think that what's important is that we go back to that algorithm that I showed you, and that we're now starting to think about biologics and also different delivery systems for steroids. So I think that it's important that if you're going to have a patient go through surgery, that you don't do the same thing that the first time, which is just to do surgery and perhaps not follow it up with intensive medical therapy, which may include a biologic, an enhanced delivery system, aspirin desensitization, or a combination of all those therapies. And the last question is, do antihistamines reduce the growth of polyps? They do not. So a lot of people take antihistamines hoping that they'll reduce the size of their polyps, but what they really do is just take away some of the sneezing and the itching in the nose. Really don't have any, and they don't really have any effect on polyp size or polyp growth. Another question, would you recommend a biologic before surgery? Well, there are certain situations where that might be the case, and we go back to the algorithm, and there are patients who are not good candidates for surgery, but probably the majority where we go biologic first would be a patient who has very uncontrolled asthma. Despite standards, their asthma is uncontrolled, and there you have a reason. You have a patient who has severe asthma and nasal polyps, and in order to get some control of disease, where I'd want to get the asthma under control first. And that I think that concludes the questions. And thank you again, Sanaz and Dana, for joining us today and providing us with informative discussion. Thank you to our audience for joining us for the Special Patient Education Program. I'd also like to thank the Asthma and Allergy Foundation of America for their collaboration on this program. Support for this program was provided by Optinose US Incorporated, Regeneron Pharmaceuticals Incorporated, and Sanofi and Genzyme. Please remember to complete the questions at the end of the program to help reinforce some of the topics we covered today and to also receive a participation certificate. As a reminder, see the event resources section of the player located under the video box to download today's presentation slides. My name is Dr. John Boss. Thank you for joining us.